Welcome to Vertical Movement PT. I'm Dr. Cindy Kimmy, physical therapist. Today we are going to do a routine for Patellofemoral Syndrome, also known as runner's knee. So the idea is for you to follow along step by step so it feels like that we're together and we're working together as a team. So go ahead, put on a comfy outfit, find a nice and quiet place, and save some time just for you. All right. Let's get started. Patellofemoral syndrome is also known as runner's knee, and it's called runner's knee because it's really common for runners to get this disorder. So for patellofemoral syndrome, what happens is there's pain on the top of the knee, underneath the knee, or around the knee. So it's a very broad term to describe this pain. So what's happening and what causes this knee pain is that the patella right here is misaligned and it's not in the patellar groove. And what happens is that it's rubbing against the femur, either on the inside of the femur or the outside of the femur. So think of a train on train tracks. When the train isn't on the train tracks, there is sparks and there is, fire. So think of the same thing with the patella. The patella is supposed to go inside the patellar groove. And when you bend your knee, the patella slides down. And when you straighten your knee, the patella slides up. But if it's off track, it's going to rub against the femur, which is the bone underneath, and it's going to cause that pain, inflammation, and eventual wearing out of the cartilage that's underneath the patella. Patellofemoral syndrome pain, it can happen from when you are running, when you are climbing stairs, when you are squatting, or putting pressure on the kneecap, or putting pressure on the leg while it's bent, and also from just sitting for a long period of time. It's important to check with your local physical therapist or with your physician just to get the proper diagnoses, because having pain in the front of your knee could also be other things, such as patellar tendonitis, and that's when there's pain or a disorder of the patellar tendon. It could be a patellar dislocation, and that's when your patella gets dislocated. It could also be Osgood-Schlatter's, and that happens in children when they're growing. That's inflammation of the bony growth of the tibial tuberosity. It could also be, say this 3 times fast, Sinding-Larsen-Johansson disease, and that's when there's inflammation of the inferior pole of the patella, and that also happens in children. Treatment for patellofemoral syndrome is best when it's focused on doing hip and knee exercises versus just doing knee exercises. And research also shows if you're having so much knee pain and it's the start, the very beginning of you having knee pain, you can actually go ahead and focus on doing strengthening exercises and mobilization exercises for your hip until your knee starts getting a bit better and it has less pain. Then you can go ahead and implement the knee exercises. We're going to go ahead and start the soft tissue mobilization portion of this routine. And I have here is a baking roller. You can also use a muscle stick if you have that. That's probably what it's meant for, but I like baking rollers better because I think they're heavier, sturdier, and I think they do a better job. So we're going to start with doing a soft tissue mobilization of the quadricep muscle. Make sure your baking roller is clean, and you're going to go ahead and roll on top of the quadricep muscle. You want to go ahead and go all the way down to the top of the kneecap. Avoid getting on that kneecap. So kneecap is another name for the patella. If you squish that kneecap down, that is going to aggravate the pain that you have right now. Go ahead and go a little bit on the side here. The quadriceps consisted of 4 muscles, and this is the lateral vascularis. And then you also want to get the inside here, and that is the medial vascularis, so the other quadricep muscle. Okay. And you can go ahead and pause the video for a minute or two and go ahead and roll out. Okay, next we're going to go ahead and do a soft tissue mobilization of the IT band. So you can also use the roller here, and you can roll on top of the IT band. It's right here along the side. And IT band is a bit painful to work over. So what you could do is you can work on the sides of the IT band on the top and the bottom. That definitely helps loosen it up. Going up and down, and trying to get under if you can. You also want to make sure, it's very important to get the TFL muscle here. And that's right on the top here. And the IT band attaches to that. So it's really common for people to have IT band syndrome, and that contributes to their Patellofemoral Syndrome. You could also use a foam roller to help roll out your quadricep muscle and your IT band. So what you're going to do, you're going to place the foam roller on the floor, place your quadriceps on top of it, forearms on the ground, and you're just going to go ahead and roll it out. You could do this for about a minute to 2 minutes or even longer if it feels really good for you. You can also go ahead and roll out the psoas. So that's the hip flexor muscle right over here in the front. And what you want to do, you want to get the inside edge of the foam roller. You're going to place that right in the groove of your hip. Your other leg's going to be slightly bent. And you're just going to go ahead, bend that knee and lift it up. You're going to feel pressure, maybe a little bit of, not pain, but a discomfort. That's about right. And you just kind of want to roll that out to get that tissue nice and loose. So next, to go ahead and roll out the IT band, you're going to go ahead, place the roller on the ground. Your IT band's right over here. And on your forearm, other leg over just for balance, you're going to roll out the IT band. Remember that you want to focus on the muscles around the IT band, so rolling forward to get the quadricep and that TFL muscle on the top. That's going to be sore on a lot of people. And you can roll backwards to get that hamstring muscle there. It helps to loosen up the IT band when you go ahead and you address the muscles that are around it. And it's less painful than rolling right on top of the IT band. Okay? But there you go. You can go ahead and pause the video and roll out for a minute and two, and you can go ahead and start it when you're ready. Next, we're going to go ahead and do the stretching portion of this routine. Our first stretch we're going to focus on is the quadricep stretch. So you can go ahead and grab the wall or a chair if you need it, and you're going to go ahead and grab your ankles, bring your foot close to your bum. You just want to make sure that your leg is nice and straight. You want to avoid having your knee bent like this because you're really not stretching anything. If you have it nice and straight, then you'll go ahead and feel that stretch along that whole thigh. So you're going to go ahead and hold this for 30 seconds, making sure that your pelvis is neutral, so tuck that tailbone in. You'll feel that stretch a lot more when you do that. And core nice and tight. Okay, so go ahead and then let's switch to the other side because you always want to be even. The same idea, thigh nice and straight. And then if you find that this stretch is too much and you're having pain in your kneecap, you can go ahead and put a chair behind you and just place your foot. Actually, I'll use a little table here. You can just place your foot on the chair or table and you'll still feel that stretch in the front of your thigh. And as it goes ahead and gets better, you can increase the range of motion of bringing your leg closer and closer and closer until that flexibility, that quadricep muscle is there. Next, we're going to go ahead and do the hip flexor stretch. And that's going to stretch out our psoas right over here, so our hip flexor. So we're going to start with the left side. You want that left leg behind you, the right leg in front. You can hold onto something for balance. And you're going to go ahead and tuck that tailbone in. So you want to tilt that pelvis back to feel that stretch right there in the hip. And then leaning forward. So back leg is straight, the front leg is bent. And make sure your torso, your trunk is nice and straight and that you're not leaning forward because you won't feel the stretch if you're forward. Nice and straight there, leaning into it. You want to hold the stretch for 30 seconds. And as you feel the tension start loosening up, you can go ahead and go deeper into the stretch going forward. Okay, so next let's go ahead and switch to the other side. and you want to have your right leg back now to get that right hip flexor. Make sure your toes are straight forward. You don't want them off to one side because then you're not really going to get that hip. Tilt that pelvis backwards, that posterior tilt, getting that tailbone between your legs and leaning forward. Making sure that trunk is nice and straight. You want to make sure your head is in line. You can kind of imagine as if the string is pulling you straight up. That's a good thing to think about overall in the day. Helps with your posture. And as your hip starts loosening up, go ahead and dig a little bit deeper into that stretch. Okay? Now we're going to go ahead and start the strengthening portion of this routine. And the idea is for this to feel like you aren't doing the exercises alone, but you have a step-by-step guide doing the work with you. Research shows that most people with Patellofemoral Syndrome, they tend to have weak hip extensors and hip abductors and hip external rotators. So this strengthening portion is going to address all of those weaknesses. The first exercise we're going to do are clams, and that's going to help with the hip external rotators and hip abductor muscles. So you're going to go ahead and sit right over or lay down on your side, and you can put your arm underneath your head to support you or put a pillow. Keep your ankles together, and to do the clams, you're going to go ahead and lift your knee up and bring it back down. You should go ahead and make sure that your core is nice and engaged, that your pelvis is neutral, so you want to tuck that tailbone in between your legs so your pelvis isn't out like this, it's neutral. And you should feel it right over here on your gluteus medius. So we're going to do a total of 10 of these. So go ahead and just do about like 5 more. Keep that core engaged. I know I have to constantly tell myself that. Okay, 2 more. And last one. Very nice. And then now you want to go ahead and switch over to the other side because you always want to be even. Even though if you have pain just on the left knee, you want to work both sides for stability. Okay. So same idea. We're going to do 10 of these clams, making sure that your neck is also aligned with your spine so that you're not flexed forward. You might feel that there's a difference in both of your hips, that one hip might feel more stiff than the other, or one hip might feel weaker than the other. I definitely feel that this hip has a lot more tightness and weakness than my left side. Okay, last one. Awesome. Next, we're going to go ahead and do hip extensions. So you're going to go ahead and lay on your tummy. You want your head to be flat down so that you're not extending up from your low back. And you're going to go ahead and lift your left leg up and back down. So this is working the gluteus maximus. You want to make sure that you're not arching from your low back, but you're getting all of the movement from your hip. So we're going to do a total of 10 of these. Let's do about 5 more. And then if you have like ankle weights at home, you can go ahead and add those. And I'm going to go ahead and show you my homemade ankle weight. Okay, very good. And then you're going to go ahead and switch to the other side. So I'll show you the homemade ankle weight on round 2, okay? So let's do 10 of these. Same idea, having your core engaged. You always want to make sure your core is engaged for any sort of exercise. It's literally the very core of you. And it stabilizes your whole body, including your shoulders, your neck, your knees, your ankles. Having a strong core and a core that's actually engaged, so important. Okay, last one. All right. Next, we're going to go ahead and do a knee strengthening exercise. So we're going to go ahead and strengthen the quadricep muscle with knee extensions. So you're going to go ahead and straighten your knee and bend it. This is the working muscle right over here. So you're going to go ahead and do 10 of these. If you have an ankle weight, you can go ahead and attach that to the base of the ankle, or you can go ahead and use bands if you have bands, and you can attach it here at the base behind you so that you can pull it up. But to start, especially if the injury is acute, so meaning that it's fresh and it just started. It'd be good to just do body weight and using gravity. Okay, let's go ahead and do about 3 more. On the second round, I'll go ahead and show you this exercise with my homemade weight. Okay, let's go ahead and switch and do the other side. Because even though your pain's only on the left knee or one of the knees, you just always want to be balanced. Sometimes I find with my patients that they have an injury on one side, we strengthen that side, and then they find that that injury side ends up becoming stronger than their non-injury side, and then they're asymmetrical. So it's always good to be symmetrical as much as possible. Okay, let's go ahead and do about 2 more. All right, awesome. Let's go ahead and start round 2. So what I'm gonna use for round 2, I have a little resistance band here. You can buy this on Amazon. I have the link on the info section if you're interested in getting one of these. But this kind of adds a little bit more resistance to your hip exercises. Highly recommend it. Super portable, great if you're traveling, and very affordable. So go ahead and get in position for the clams. Ankles together, core engaged, pelvis neutral. Go ahead and let's start. We're going to do 10 of these. Remember, you should feel it right along the gluteus medius. Also making sure you're breathing through your diaphragm, not your chest. Okay, let's go ahead and do 4 more. All right, and last one. Great. Let's go ahead and switch to the other side because it's so important to be even. Helps with your stability and it's super important for knee stability. All right, same idea. You want to go ahead and do 10 repetitions of these. Core engaged, neck aligned. It's a lot of coordination thinking about all the things you have to focus on. But with practice, you will get better and you will see a huge improvement in your knee stability. And an improvement in your glutes. Okay, go ahead and do 1 more. All right, next let's go ahead and do hipping. Next, let's go ahead and do hip extensions. So I'm gonna keep the band here just to show you what it looks like if you want a little bit more resistance. Just make sure that your hips, they're aligned with your ankles. So you don't want your ankles to be inside because then you won't really feel that much tension. But you want to go ahead and make sure that they're a little bit out right along the line of your hips, okay? So down flat head, and you're gonna go ahead and lift up. Making sure that your core is engaged, you're not using your low back. All right, let's go ahead and just do about 3 more. Focusing on that glute extension. All right. Now we're gonna go ahead and do the other side, but I wanna show you my little homemade ankle weight. If you don't wanna buy extra equipment or if you're just not into having a lot of fitness equipment, you can go ahead and use your sock. So I stole my husband's sock. And you can go ahead and fill it with rice. You can fill it to the amount, so you can have different weights. If you have a scale, you can measure like a 1 pound weight, a 2 pound weight, 3 pound weight. So you're gonna go ahead and put this on your ankle, like my homemade solution to working out. Okay, and then you're gonna go ahead and lift up. So core engaged. Making sure you're not extending from your back. We're gonna do 10 of these. And also make sure it's okay with your family to take all the rice. We definitely ran out of rice, so hope my husband's okay with that. Okay, 2 more. All right, very nice. Okay, so now we're gonna go ahead and do round 2 of the knee extension. Here I have my homemade weight. I'm gonna put it on the ankle there. And you're gonna go ahead and extend and back down. You can go ahead and also hold on to your knee if you feel like you just need a little stability to keep the knee straight. But it is best if you can get that stability on your own. But in the very beginning, and if you just feel like you're just too weak and that your knee kind of keeps wobbling, you can go ahead and hold on for that extra support. Make sure your core is nice and engaged, that you're sitting up nice and straight, like the strings pulling up on the top of your head. Okay, let's go ahead and do about one more of these. All right, now let's go ahead and switch to the other side, just to be symmetrical. And you know, this little weight I made is also a really good heating pad. If you microwave it in 30-second increments, take it out every 30 seconds just to make sure you didn't overcook the rice. It's a really good heating pad. You cover it with a towel. It's great for the neck. So these are my home remedies. If you're trying to save money, you don't want too much stuff. Okay, last one. All right, guys, you have done it. You are done with this routine, and I am so proud of you. I recommend doing this routine 2 to 3 times a week for 4 to 6 weeks to get the improvements that you're hoping for. And if you find that your knee is not improving, please go see your local physical therapist because you need a specific exercise plan that's just for you. But if you like my videos, go ahead and support me and subscribe. Go ahead and like this video. I ever so much would appreciate it. But alright guys, I love hanging out with you and I can't wait to see you next time. Peace.